So in the office, what we do is a couple of educational stuff, just hints and tips and pointers. I use the website pretty extensively for patient education with an iPad. And I go to the topic page, for instance, what their mechanical diagnosis is, and I go through with them how to get there after they leave the office to reinforce. So what I learned as an educator when I was director of medical education is adults need to hear things 3 times. And I know that even if I spend an hour with a patient in the room, they still won't remember more than 5 to 10% of what I told them. So I'll go through it with them once, I'll go through the website, and then talk to them about what to do about it. And they can take that information home and use it afterwards. I also look at patient-reported outcomes. So one of the stuff we're going to talk about soon with our training staff is how do you use this patient-reported outcomes? Well, I'm going to show you how we used it by assembling data over the last couple of years for my patients using OBIRD. Now we're going to switch to Patient IQ, and then you'll collect your own data going forward that you can show patients individually, as well as your aggregate patients across your patient population with the same diagnosis. So this is my total knee population. Patients will ask, how long does it take to get better after surgery? And we show them their functional score pre-op, if they're about a 50. The average patient population where they kind of climb up to is about 80 to 86, with or without pathology. So we can tell patients based on this track record of me collecting this data over the past couple of years that they'll be in about 2 months, about 2/3 of the way better, and by about 6 months they'll pretty much plateau, and they'll get a little bit better by about a year or so. So after a knee replacement or after a hip replacement, I can tell patients how they're going to do when they ask that question. That helps them plan out their lives. Plus it also shows that we're collecting quality data, and it lets me help track how we're doing with our program. And we've gotten better, over time, and we're kind of doing that follow-up. So it's really important that you get your patients' pre-op scores, 90 days ahead of time at least, their comorbidity for risk adjustment, and then post-operatively at 2 weeks, 6 weeks, 3 months, 6 months, a year, and 2 years. And if you can do that with most of your surgical procedures that are heavy procedures, not just the knee scopes, but total joints or the bigger procedures, we can submit that information for quality data and track that for insurance company contracting, Medicare, and MIPS qualifications and also Center of Excellence. And the important thing is to make sure on the website that you're educating the patient, and then actually this is stored on our website now and available as my data, and you can store your data on there too, or within the Patient IQ program, you'll be able to go to the patient's page eventually and develop aggregate data for them, and then for your whole population. For the whole population, we can publish that in an easy to get to site on the website, so you can refer to that and change that every 6 months or so. For individual patients, Patient IQ is developing dashboards like this for the individual patient.